What if the very medical tests you believe are protecting you in your golden years are instead putting your health in serious danger? This isn't a hypothetical scare tactic. It's a growing concern within progressive medical circles that challenges the very foundation of routine preventative care for seniors. We have been culturally programmed to believe that more testing equals more safety, that early detection is an indisputable good. But a deeper examination of the data reveals a troubling paradox. For individuals over the age of 70, the well-intentioned path of aggressive screening can sometimes lead directly to a quagmire of unnecessary procedures, debilitating side effects, and a significant decline in the very quality of life we aim to preserve. Modern healthcare has a silent epidemic, one that most physicians will never bring up in your annual visit. It's the epidemic of overtreatment, fueled by a standard protocol that often fails to account for the unique physiology and priorities of the older adult. Every year, countless adults over 70 follow standard advice, submitting to routine screenings with the hope of catching problems early. They place their trust in a system that promises security through technology. But emerging research paints a disturbing picture. A significant portion of these common procedures can trigger a cascade of overtreatment, leading to complications you never saw coming. This cascade often begins with a false positive, or an incidental finding, a meaningless shadow on a scan or a slightly off-kilter number, and spirals into a diagnostic odyssey of more invasive tests, potent medications, and even surgeries for conditions that may never have caused a single symptom in your lifetime.
The physical, emotional, and financial toll is immense. Today, we're revealing 5 specific health evaluations you should seriously reconsider after age 70, backed by data, and the first one has been linked directly to causing cancer. We will explore not just the what, but the crucial why, giving you the context to understand how standard medical logic shifts after your 7th decade. Let's begin. Before we dive in, tell us in the comments, where are you watching from, and have you or a loved one ever experienced a medical test that felt unnecessary? We read every comment. Don't forget to like this video and subscribe to the channel Wines of Thought for more insights that empower your decisions. Now, let's get into the first checkup that's far more controversial than you know. Checkup number 5, the routine bone density scan. It appears completely benign. A simple, painless machine scan that promises to gauge your fracture risk. However, for many in their 8th decade and beyond, this test often manufactures more anxiety than actionable insight. The promise is clear: know your score and prevent a debilitating hip fracture. But the reality is far murkier, steeped in statistical nuance that rarely makes it to the patient's ear. The DEXA scan measures bone mineral density, primarily to diagnose osteoporosis. Yet in older adults, especially women, the readings almost invariably show lower density, because some bone loss is a natural companion to aging, like changes in eyesight or hearing. Our bones, like every other tissue, remodel themselves over time, and the balance between breakdown and rebuilding slowly shifts.
The DEXA scan captures a single moment in this lifelong process and compares your bones to those of a healthy 30-year-old. It's a standard that inherently labels almost every senior as deficient. This number on a report can instantly funnel patients towards potent medications, such as bisphosphonates. These drugs work by powerfully suppressing the body's natural bone remodeling process. While this can increase mineral density on a subsequent scan, it comes at a cost. These drugs carry significant risks, including rare but severe jawbone deterioration and significant esophageal inflammation, but also more common issues like unusual thigh bone fractures and severe bone and joint pain. Here's the crucial point that changes everything after 70. Treating minor bone loss detected after 70 with these medications shows a negligible effect on preventing actual fractures for most. One major study tracked women over 70 and found the fracture risk reduction after 5 years of medication was statistically tiny. We're talking about a reduction from a small risk to a marginally smaller risk. Meanwhile, the chance of enduring drug side effects was substantially higher. The calculus of benefit versus harm fundamentally changes with age. The goal shifts from chasing an ideal bone score to preventing the actual event of a fall and fracture. So what's the alternative that doesn't involve a scary diagnosis or risky pills? Consider the story of Eleanor, a vibrant 78-year-old gardener. A routine DEXA revealed mild osteopenia, the precursor stage to osteoporosis. Pressured into medication by a well-meaning doctor focused solely on the printout, she soon developed terrible heartburn and a persistent, unsettling jaw discomfort. Her passion for gardening faded, replaced by caution and worry. When she stopped the drugs and focused instead on consistent weight-bearing exercise like walking and light resistance training, targeted nutrition with calcium-rich foods and vitamin D supplementation, and dedicated balance training like Tai Chi, not only did her symptoms vanish, but her strength and stability improved dramatically a year later. She strengthened the muscles that supported her skeleton and improved her coordination, addressing the true cause of fracture risk, the fall itself. A number on a scan should never dictate your quality of life. The science is clear. For seniors without a history of fractures, lifestyle interventions are frequently safer and more effective. Focusing on fall prevention through home safety, strength, and balance is often the highest yield investment. But another common scan, sought in moments of fear, can lead you down a path towards something even more alarming: unnecessary brain surgery. Checkup number 4. The brain MRI for minor forgetfulness. When memory lapses occur, forgetting a name, misplacing keys, fear of dementia is natural and visceral. The response, both from a worried patient and a defensive doctor, is often to order a detailed brain MRI. The hope is for a clear answer, a definitive all clear, or a target for treatment. This imaging tool, however, rarely provides the clarity we seek for age-related forgetfulness. In fact, it usually reveals what radiologists call age-appropriate changes, small shrinkages or harmless white matter spots that are as common in older brains as wrinkles on skin. These findings are a map of a life lived, not a forecast of cognitive doom. The profound danger lies in the aftermath of the scan report. These incidental findings, meaningless in isolation, can ignite a firestorm of fear and anxiety in a patient's mind. The term white matter changes can sound like a disease progressing. This psychological toll is often just the beginning. It can lead to a diagnostic cascade of more invasive tests, like spinal taps to check for infection or biomarkers, or even needless biopsies, all based on vague scan results that have little correlation with everyday memory function. A review of thousands of scans in seniors with mild complaints found that the vast majority of abnormalities were benign, yet a significant percentage of patients endured the distress, cost, and physical risk of follow-up procedures. The mind is powerful. The belief that something is wrong with your brain can itself exacerbate memory issues through anxiety and depression. Take Arthur, a 72-year-old retired teacher who worried about misplacing his glasses more frequently. His primary care doctor, wanting to be thorough, sent him for a brain MRI. The report stated non-specific white matter changes consistent with microvascular ischemia. To Arthur, this medical jargon translated to, "My brain is breaking." He spiraled into anxiety, believing early Alzheimer's was inevitable, and withdrew from social life and his beloved book club. A simple, standardized cognitive function test administered later, however, confirmed his memory and processing speed were solidly within the normal range for his age. His focus was then shifted to modifiable factors, improving his sleep hygiene, ensuring proper hydration, as even mild dehydration impairs cognition, and engaging in mentally stimulating puzzles and reading. Within months, his confidence returned, and his perceived memory lapses diminished. The lesson is critical. Unless severe symptoms exist, like sudden onset, getting lost in familiar places, or profound personality shifts, a basic cognitive assessment and a conversation about lifestyle is a wiser, less terrifying, and more informative first step than an immediate dive into imaging. Now brace yourself for number 3, a test you've likely been offered many times, often presented as the gold standard of cardiac safety. Checkup number 3, the cardiac stress test without clear symptoms. This test, monitoring your heart's electrical activity and blood flow during treadmill exercise or pharmaceutical-induced strain, is standard for investigating vague fatigue or mild, atypical chest discomfort. After 70, however, its reliability drops sharply. The aging heart and vascular system develop more noise, benign irregularities, mild stiffening, and other changes that can mimic the signs of blockage on a stress test. This leads to a high rate of false positives, producing alarming results at a rate that can exceed 40% in older, asymptomatic populations. These false positives are not harmless. They frequently trigger a mandatory and invasive protocol of coronary angiograms and can lead to stent placements or even bypass surgeries that were never needed. Research from leading cardiology journals indicates that many of these interventions in asymptomatic older adults do not improve survival or quality of life. The studies are sobering. Placing a stent in a stable, partially blocked artery that isn't causing symptoms does not prevent heart attacks or extend life for most patients in this age group. Instead, patients face the very real and immediate dangers of the procedures themselves: kidney injury from the contrast dye required for angiography, bleeding at catheter insertion sites, strokes, or hospital-acquired infections. We are trading a hypothetical small future risk for a concrete present-day risk. Consider Raymond, a fit 76-year-old who walked 2 miles daily. At a checkup, he mentioned occasional tiredness on hills. His doctor, erring on the side of caution, scheduled a stress test. The results were ambiguous, showing a possible reversible defect. This led to an angiogram, where a catheter was threaded to his heart. A mild 50% narrowing was found in one artery, a finding common in aging, and a stent was placed. That night, Raymond had a severe reaction to the contrast dye, spiraling into acute kidney injury. He spent nearly a week in the hospital and needed follow-up renal care for weeks. His original fatigue? It was related to mild dehydration and the natural need for more recovery time, not his heart. For seniors without classic cardiac symptoms like chest pain during activity or pronounced shortness of breath, a resting EKG or a coronary calcium score, a quick CT scan that measures plaque buildup, is often a safer, more informative, and less anxiety-provoking starting point. And now, we approach the second most overprescribed checkup, one that might truly shock you, given its reputation as a life-saving staple. Checkup number 2, the automatic colonoscopy. After 70, this invasive colon exam is not automatically the best choice for seniors without symptoms. The medical guidelines are clear, yet they are often overlooked in practice. The preparation is harsh, involving powerful laxatives that can lead to dangerous dehydration, electrolyte imbalances, and dizziness, posing a serious fall risk for older adults. The sedation itself, while generally safe, poses added cognitive risks for the aging brain, sometimes leading to prolonged confusion or exacerbating underlying conditions. The procedure, while low risk, is not risk-free. It can cause perforations, significant bleeding, or trigger heart rhythm disturbances during sedation. The balance of benefit and risk pivots dramatically with age. A large study of Medicare patients found that for those over 75, the rate of serious complications from the colonoscopy began to outweigh the life-saving benefit. Use a female clear American voice for the narrator. The math becomes stark. It takes roughly 10 years for a benign polyp to transform into cancer. Therefore, finding and removing a small polyp in an 80-year-old often intervenes on a problem that would never have become clinically significant in their lifetime. Many polyps found are slow-growing and unlikely to cause harm, yet their removal subjects the patient to all the immediate risks of the procedure. Darla, a healthy 74-year-old with no symptoms, no bleeding, no changes in bowel habits, and no family history of colon cancer, was persuaded into a screening colonoscopy by a new doctor. She had already had 2 clean colonoscopies at ages 50 and 60. During the procedure, a small, benign-appearing polyp was removed. That night, she experienced intense abdominal pain and fainted. At the hospital, they found a bowel perforation. She required emergency surgery, spent 9 days in recovery, lost a drastic amount of weight and muscle mass, and has struggled with digestive sensitivity ever since. For most individuals, authoritative guidelines recommend stopping routine screening at 75. For those between 70 and 75 in good health, safer home-based stool DNA or immunochemical tests, FIT tests, offer effective monitoring without the invasive risks, PrEP, or sedation. It is a conversation about smarter, more personalized surveillance. But the #1 checkup on this list is the most alarming of all, and it's aggressively marketed to health-conscious seniors as the ultimate in high-tech prevention. Checkup number 1, the preventive full-body CT scan. Marketed directly to consumers in private clinics and executive health packages, these scans bombard your entire body with high-dose ionizing radiation under the banner of catching hidden cancers early. For seniors, they are essentially a factory for manufacturing false alarms, leading to an inescapable chain reaction of more scans, invasive biopsies, and immense, life-altering psychological stress. It is crucial to understand. There is no conclusive evidence from any major medical body that full-body scans save lives in asymptomatic people. Not from the American Cancer Society, not from the American College of Radiology. The radiation dose is not trivial. One full-body CT scan delivers a dose equivalent to hundreds of chest X-rays, cumulatively increasing your lifetime risk of developing cancer. Modeling studies in prominent journals have suggested that the skyrocketing use of medical imaging may now be a contributing factor in a notable percentage of future cancer cases. A tragic and profound irony, where the search for cancer becomes a causative agent. The scan itself is a fishing expedition, detecting harmless nodules, benign cysts, and calcifications that are simply part of the landscape of an aged body. But the moment they are seen by a radiologist, protocol demands they be noted. A red flag is raised, and the patient is sucked into a vortex of specialist referrals, higher resolution scans like PET scans, and ultimately, biopsies for lesions that have a 97% chance of being benign. Create a video for YouTube using exactly this script. Create a video for YouTube using exactly this script. Consider Martin, an active 79-year-old who felt perfectly well. Lured by a brochure for a comprehensive senior health assessment, he underwent a full-body CT. It revealed a tiny 3mm lung nodule. This seemingly insignificant finding sparked a nightmare. A referral to a pulmonologist, then an oncologist, a follow-up PET scan that showed minimal activity, and finally a needle biopsy to be sure. The biopsy result was, predictably, benign. The cost, however, was a punctured lung that collapsed, requiring a chest tube and a 2-month recovery period that robbed him of his independence and vitality. Searching for problems where none exist can create the very harm you sought to avoid. Medical authorities are unequivocal. Full-body scans should never be used for routine screening in asymptomatic adults. They are a tool for diagnosis when symptoms point to a problem, not a crystal ball. So, there you have it. 5 common checkups that demand a second opinion, a thoughtful pause, and a detailed conversation once you're past 70. Modern medicine is a powerful tool, but it is not an imperative that must be blindly followed. Your body is not a machine that simply needs more diagnostics. It is an intricate system that thrives on balance, prevention, and mindful care. Your best defense is cultivating a trusted, collaborative relationship with a primary care doctor who focuses on you as a whole person, your function, your goals, your quality of life, not just as a collection of test results and potential pathologies. This partnership allows for shared decision-making, where you are an informed participant, not a passive recipient. Use a female clear American voice for the narrator.
Prioritize the foundational elements of robust health. Consistent movement tailored to your ability, nourishing whole foods, deep and restorative sleep, and meaningful social connection. These are the true pillars of prevention, with an evidence base far stronger than any routine screening after a certain age. They strengthen your body's resilience, support your mental acuity, and enhance your daily joy without a single side effect. Now we want to hear from you. This is a vital conversation. Have you ever questioned a doctor's recommendation for a test or procedure? What was the outcome? Did you seek a second opinion? Share your story and your insights below. Your personal experience is a powerful guide for others navigating these complex decisions. If this video helped you think more critically about your health choices and empowered you to ask better questions, please give it a like and subscribe to Winds of Thought. Our channel is dedicated to providing you with the nuanced, well-researched information you need to navigate aging with wisdom, agency, and confidence. Thank you for watching and for investing in your most valuable asset, your well-being.